We chose how COVID-19 impacted a large city financially. And so we decided to look at Las Vegas, Nevada. And so the problem is closing the state of Nevada as a COVID-19 government response. So Las Vegas, Nevada is heavily dependent on their gaming industry and their tourism. And so COVID-19 had a very significant financial impact on the city due to the mandatory shutdown. On March 17th in 2020 is when the governor orders the statewide shutdown of casinos and all other non-essential businesses. So essentially the entire strip in Las Vegas was shut down, and all leisure and hospitality jobs were halted, and they were the last to return. And I found an example online where a gentleman, he had been working in the hospitality field since he was 18 years old, and he was now 52 years old, so he had been in the field for many, many years, and his job was to deliver room service to high-end hotel rooms. And that essentially came to a complete stop whenever this government shutdown was ordered, and he ended up losing his job, and today he is still struggling to get back into the workforce. So this policy shut down the industries that really serves as the backbone of the Las Vegas economy.
The impact of the policy on Las Vegas included health versus income, education, revenue, and expenditure. The governor of Nevada used policy to close the tourism industry. He was praised by some for helping to stop the spread of the virus. However, unemployment in Las Vegas skyrocketed. Businesses were shut down, and the virus continued to make its way through the city, making it a hot spot for COVID-19 in July 2021. When public services begin to get interrupted because of revenue loss, safety and well-being of people becomes a big concern. The Clark County School District had a district quarantine in place until August of 2022. This led to students missing multiple days of school and not receiving the proper education or care they needed, and parents having to be absent from work to stay at home with their children. Las Vegas experienced a major loss in revenue during 2020. Las Vegas lost a lot of revenue due to a decrease in tourism, which then trickled down to Las Vegas vendors and employees working in tourism. There was a drastic change in spending for vendors in 2020 compared to 2019, and as well a drastic change in spending for employees in 2020 versus 2019. With the loss of revenue came the need for a reduction in expenditures. The city of Las Vegas received federal coronavirus relief funds in the amount of $119 million. The city spent $102.2 million of it on either its public safety payroll or to support pay for employees whose jobs changed during the pandemic, spending only 5% on economic support. The city had a budget surplus heading into the pandemic, but was soon expecting a financial situation so dire that they expected to be in default by 2021. The coronavirus relief funds helped them maintain the city council's priority of public safety without brownouts of fire stations or longer wait times for 911 calls, and the city avoided more than 200 layoffs. However, when it came to expenditures, the city of Las Vegas implemented a hiring freeze to save $8 million in the general fund. This graphic illustrates how in 2018 and 2019, expenditures were less than revenue. However, in 2020, expenditures greatly outweighed revenue. When constructing policy alternatives, some questions we can ask ourselves to help increase our preparedness are: how can we better assess the risk of the pandemic? How can we better be prepared and stocked with the right equipment to address a pandemic? And how can we better communicate and partner with stakeholders and citizens? When responding to the COVID-19 pandemic, alternatives to the policy of closing down the state's gambling and gaming facilities could have been to implement vaccinations at a high rate, implement strong masking requirements and cleaning standards for the facilities, and allowing businesses to be open on a volunteer basis. Those who have been vaccinated and are willing to stick to the standard of masking, effective hygiene, and cleanliness could be allowed to staff gambling and gaming facilities. This would allow for facilities to stay open and produce revenue while also addressing the possibility of contamination. An alternative to closing schools could have been to implement strong social distancing by introducing individual desk shields, spaced sitting at lunch, and the use of remote learning for those who tested positive for COVID-19 until they've recovered, along with the use of masks, proper hygiene, and cleaning protocols. An alternative to the statewide travel restrictions, which included a 3-week pause on travel to the state in November 2020, the policy could have established a required quarantine for out-of-state travelers and a required COVID-19 negative test to end quarantine, along with strong vaccination, masking, and hygiene requirements. Creating policies that would have allowed for Las Vegas to utilize a more individual approach to fighting COVID-19 could have combated the financial burden on businesses and families, allowing employees and citizens to decide for themselves if they are willing to go to work, go to school, or travel during the pandemic, while adhering to safety guidelines could have lessened the impact on individuals' income as well as the city's revenue, while still mitigating the effects of the pandemic. Government could have focused on ensuring medical supplies, to include vaccines, were available and having better communication with stakeholders and citizens to allow for information about the risk and safety measures to be better understood.
So when we think about the goals that these alternatives should meet, we want to have the ability to respond swiftly and effectively should another pandemic occur. So if we can get those safety measures in place early so individuals can choose and return to the workforce safely, the cost of these alternatives do not outweigh the benefits, making these goals economically feasible. And the advantage of being able to provide the essential materials to keep individuals safe is that then the community would not need to be shut down.
According to the EOCD online article, pandemic preparedness is the government's ability to anticipate a pandemic. Crisis response requires transparency in decision-making and clear communication with the public. Response and recovery policies are mitigating the impacts of the pandemic and economic crisis on citizens, businesses, and supporting economic recovery and reducing welfare losses. When assessing the alternatives listed above under constructing policy alternatives, my assessment is that governments did the best they could with this unexpected pandemic. However, according to research after the fact, mandate propensity, a summary measure that captures a state's use of physical distancing and mask mandates, was associated with statistically significant and meaningfully large reduction in the cumulative infection rate, but not the cumulative death rate. This supports the use of a less intrusive policy as outlined in the policy alternatives section above.
Our recommendation for this policy would to be avoid the stay-at-home order in all. The alternatives that we discussed can solve the problem, and it allows the community to move along their everyday lives without the interruption of a government shutdown. And it will keep people in the workforce safely and also give them the choice to return to work if they choose to do so. So again, our recommendation is to avoid the stay-at-home order and be able to put those measures in place. If this were to occur again, then we would be ready. And that is all that we have, so thank you for listening.